morning, everyone. Thank you very much for the opportunity to be here. My name is Brian Shear. I'm a PGY3 at University of Maryland Shock Trauma. I'll be going into shoulder elbow. I'm excited to share my research. Your iPhone knows how you recover from your fracture. Here are my disclosures. So if we think about the ultimate goals in orthopedic trauma surgery, some people would argue it's getting that perfect x-ray. Some would argue it's getting the nail in as fast as possible. But at the end of the day, I think we can all agree that we ultimately want to restore function for our patients. And the question is, how do we really measure function? We see our patients in clinic, we do physical exams, we do patient-reported outcome measures. But these are all severely limited in that they only capture time at a single time point, and they're fraught with bias and errors. If we think about functional recovery overall, we have patients with a baseline level of function. They sustain an injury, that goes down, they recover over some time period, and they reestablish a new baseline. And today, we only see patients at time point 0 in the trauma bed, see them at some point along the recovery, and then when they reestablish that new baseline. We truly don't know what happens in between all of those, and we have no idea how functional they were before their injury occurred. So the injury recovery curve could look something like this, or even this. And ideally, we'd have the ability to understand how our patients are recovering along the entire spectrum of their recovery, and look back in time to understand how they were moving before their fracture even took place. So we looked to develop a new metric to do just that. And we thought, why not use the technology available to our patients that they carry in their pocket every day? We thought, looking at their phones. Roughly 60% of the US population has an iPhone. They're hosted with various sensors. And most importantly, they automatically start recording that data from day one of purchase of the device. So while there are numerous Apple Health metrics that are out there, these are the 5 that were most important to us. And again, these are all monitored and continuously and automatically. So we thought, could Apple Health be a better functional outcome metric? Well, first we need to understand, is this data actually valid? And a Nature Scientific report looked at just that, comparing iPhones to inertial sensors, and found that it was valid in those regards. So for our own study, we had a cross-sectional study with patients with lower extremity fractures that had an iPhone for at least 6 months and 6 months of follow-up. We again looked at these 5 different parameters, and we used various modeling to better understand the data. And the type of data that we're able to extract is really phenomenal. It gives us new insight to our patients overall. So here, the graph on the right demonstrates our daily step count and time since injury. You can see from this, there's roughly a 91% decline from pre-injury to post-injury, as one would expect. We're also able to demonstrate that there's a 5-fold increase from their level of activity from month 1 to month 6. However, at that time point at 6 months, it's still 60% below the baseline level of activity where they started. Taking things one step further, we thought, can we model and predict how our patients are going to recover based on various factors? This graph here, we're looking at how patients who are more mobile with patients in the solid line compared to the dotted line patients who are less mobile before their fracture, how they recover. And in all instances, the patients that were more mobile before their fracture recovered at a faster rate compared to those that were not. Taking this one step further, we looked at how does the fracture location affect how our patients are going to recover. In this, you can see our patients with the femur fractures demonstrated here in red, recovered at a faster rate compared to those in the tibia and pelvis. So before all of this, it was really kind of hard to understand functional recovery for our patients because we were lacking data. We didn't know how patients were doing before their fracture occurred, and now we do. And we were only getting episodic insights into how our patients were recovering, and now that's continuous. We've been able to demonstrate that that very data is sensitive to injury and recovery, and that we're able to predict how patients are going to recover based on how mobile they were before their fracture and the location of the fracture. But this is not without its limitations. We had a sample size of only 42 patients in our initial study, a single center at Shock Trauma, and while we'd love to use all devices, currently we're only using Apple devices. So these are still very promising early findings. We're able to understand recovery throughout the entire process for our patients. We can use this data to educate our patients and set realistic expectations for how they're going to recover. We can do real-time monitoring of our patients and help them recover. We can incentivize them to be more engaged in their recovery, and we can do some risk stratification and personalized treatments for our patients as a result of all of this data. But this is just the beginning. We need more data to better increase our accuracy and precision, and we're working on a prospective multi-center cohort trial that I cannot wait to share the data with you when the time comes. Thank you for your time.